Hello again. Okay, so just spoken to Becky. She's coming back on now. So we will answer any questions. If anyone joins who hasn't seen what we were talking about before, we can recap it. It won't be the 40-minute session we just done, but we're more than happy to start talking again about the things that we were discussing. She's here, so let's join her now. Hi, Becky. Just waiting for the connection. Also, I did pin the subject to the camera before, so hopefully it will come back on.
Sorry.
Hi! I'm so sorry. We've lost the 40-minute conversation that we had before, which people were finding useful, I think. So that's a shame. But hi to those who are joining back in. Thank you so much. We did have a couple more questions, and I'm just going to try and remember what they were since we last just spoke 15 minutes ago. So if anyone has got any more questions, then please send them our way. I literally can't remember what was just asked, but hi, Jana. Maybe that person will come back on and they can ask us. But just going to do a quick recap because we lost that. So we've talked about how we started talking to our children, your experience of picking or selecting an egg donor, and how that's playing out in terms of the stories that you're reading, especially your eldest, and the conversations that are coming up, how often we might have that conversation, and whether we talk to schools or nurseries about it, and what that conversation looks like. Also, we've talked about, and the same for me, for sperm donation. Also, we talked a bit about how that can feel as a couple in terms of whether there's any sort of feeling of disparity or kind of imbalance because one person has used their genetics and the other hasn't. So some really good, not points raised, but we've covered a lot of ground.
Yeah.
Is there anything else you just want to add to recap to that for anyone who's joining fresh, or for those who are going to watch this back because we lost the last session?
It's such a shame because we had such a great conversation.
I know.
You know, when you want to find the words.
Yeah.
So yeah, no, I think the big thing for me has always been that we'll be open from the start with the girls. I think it's really, really important for them, and I think it's important for us as well as parents to get used to having those conversations and just for it to become our normal, because it is our normal, and we want that to be their story that they then own as they grow up. So yeah,
scrapbook, don't you?
Yeah, we've have got almost started a scrapbook, and I need to add to it. It's one of those things that I never kind of got back to doing. And actually, I did do a video for Mila's first birthday, and I feel awful because I never had time to do it for Esther and Lena's. And it was basically just putting together a load of pictures, and I put some really quite emotive music to it as well. And it just kind of showed us traveling out to Prague and that sort of, and then her first year, and it was just a way of us kind of going when she turned one. Wow, like I can't believe we've got here after everything we've been through.
And what was her reaction when she watched that, or was she too young to kind of?
She was too young, and you know what? It's on an old laptop. I need to dig it out because I want to show them. But I've always felt a bit guilty because I just was so busy with three of them. I never had time to do it for Esther and Lena. But you never know. One day I may get a chance.
I'm sure you will. The questions just come back on actually before I forget. And I answered this just now. For us, we never considered using, well, we momentarily, maybe after a few glasses of wine, considered using potentially one of my husband's brothers as the donor. And then it was just for us, it muddied the water too much. The idea of cousins being half siblings, how would that feel for the sister-in-laws? How would that feel for my husband seeing the uncle, knowing he's genetically related, that kind of thing? So was that actually, because we didn't speak about this before, was that ever anything you thought about?
Well, I mean, the first thing the doctor said to me was, do you have a sister? And I don't. So it was kind of off the cards from that perspective. I had a couple of friends who said to me, oh, you can have some of my eggs if you want, which was a bit odd. And only one of them, I think, was probably more serious. But I just didn't want that. I wanted
so close.
and that was probably at the time more for me. But actually, I just wanted it to be as complicated as it is. I didn't want it to be any more complicated in a sense. And I suppose in some ways you could argue that knowing who the donor is, and it being close, it makes it less complicated. But yeah, it wasn't something I considered
I
great.
think,
Consider a no donor in that I started messaging somebody who
yeah,
was willing to donate their eggs, and it was a weird phase I was going through where I was kind of like desperate to use one in the UK, but the waiting list, I was like kind of phoning them weekly, and I wasn't getting any closer. And I got in contact with a lady who'd already got a family, and we got talking, and then it just suddenly started to feel a bit odd. I don't know why, I just didn't. And for some
had a
people it
feeling.
works really well, but it just didn't feel right. And then we started to look into Prague, and things moved, and we went down that route. But yeah, I think it's personal to everybody.
The only thing that I kind of wish we didn't have to, and we didn't talk about this before, so this is another element, and this is a difference between egg donation and sperm donation, is because we've used a donor who we don't know. It is an open donor, but we actually don't know, apart from the package we have, we don't know about them like we would someone we know in everyday life, is the fact of having no control over how many half siblings there are out there. And for a sperm donor, for example, they could help up to 25 families, and that could be quite a lot of children. And I would presume more sperm donor children, half siblings, than egg donor half
Yeah.
siblings.
Yeah, and we don't know how many siblings. And again, it didn't really cross my mind at the time. It was, when you're so focused on having a baby, and
Yeah.
I think I can't remember what the maximum number of times someone can donate their eggs, but I know it's less likely that people would do it more than a couple of times. I think because of how kind of invasive it is and time consuming
Did
and
you split the eggs with another family from the round that you had with your 3 girls?
No, it was an exclusive. So we had 8 eggs. We got 5 embryos from those eggs, 3 of which are our girls now. We've got 2 more frozen. That's another conversation for another day.
Yeah.
Uh,
Yeah.
so yeah, I think I'm pretty sure, and I don't know whether I know this or I've dreamt this, that she already had a child. So I think there is a half sibling out there at least.
Okay.
But I think it was part of the reason I wanted them to have each other in a way, that so that they never kind of felt on their own in that sense. And that's
To
why I
talk
always
to each other about it.
yeah, and probably think that they might be less likely to feel a draw towards needing to contact them. But now I've kind of got my head around, if they want to, that is absolutely fine. It's not, it's
These
totally.
are so the same emotions that we've been going through. So it really shows, doesn't it, that whichever kind of donation it is, it's very natural to feel these things. And we
Absolutely.
also talked about the fact that with our 3 children, both having 3 children, some of them might want to seek out the donor and want more information, and others might not. And we can't control that. That's life, and we'll just support those decisions as they come.
Yeah, and prepare ourselves as best we can. So someone's just asked, what's the hardest part about having a donor child? I think for me it's just the worry about how they will feel. I think more than anything, I think
We don't want them to resent us for
yeah,
being
yeah,
in this situation, but as we keep talking about, it's talked about as a plan B, but it doesn't end up being a plan B.
no.
It's an A. It's like amazing. It's not
The
something.
end result is what you've always wanted. So
Yeah.
it's just the route you take, and
And
you go a slightly different course to get there.
that's why I hate the fact that we used to say during my husband's procedure, the backup sperm.
Yeah,
Backup makes it sound like it's inferior, and it's not.
yeah,
And we talked about before the fact that we couldn't imagine our children in any other way. So some of the things that we were so concerned about, or were so important to us in terms of looks and eye color and hair color, just disappear when they're here, because it's not as important, and you can't control these things. And as someone said in our conversation before, that's the same with naturally conceived children too, that they may not end up looking like their parents.
yeah. And I think, yeah, as I said before, I don't think once you've got that child, you would look back and regret a choice around a donor, because that child wouldn't be that child without that choice, and you can't imagine doing anything differently.
I think I would answer the question we just had about what's the hardest thing about having a donor conceived child by saying that you've got that added layer of complexity, that like after IVF is done, the fertility trauma still lives on.
Yeah,
If you're conceiving with the two of your genetics. But when you've got a donor conceived child, you then need to think about the story. Well, you need to think about that too with IVF, but it's very much going to be part of your life continuously.
Yeah, it's not ends just with choosing a donor. It's a decision that then you have, and it's called in counselling, they call it implications, which I don't know, always sounds a bit negative to me, but
Yeah.
there are, yeah, there's things that you've got to do differently as a parent as a result, and you've got to have more challenging conversations than you probably would have otherwise. But I think, as I said before, I think it's actually an opportunity to build even deeper bonds through having the level of complexity around those conversations and depth of emotion and the honesty that you have to show. I just think it will teach our children so much.
And we were saying
A greater perspective on things, more than we could have had ourselves, because I mean, I'd never even given a second thought to my conception. And
no, I know. And we talked a bit before in the last session about some of the terminology that's used in some of these amazing books that are out there. We mentioned a couple. You Were Made for Me, and you've got one there, Happy Together. Really, really, there's just excellent resources out there to help you navigate that story and do it at bedtime. And your eldest actively wants to be read the story, doesn't she?
Yeah, she loves the story. She tells it herself. And I was saying earlier that the most important thing, like she said at the very end of telling my mum all about it, was, and they really wanted me.
Yeah,
and that
so lovely, so lovely.
So yeah, and I think at this age it is lovely, because they come back with questions, and it just gives you a chance to practice, and but they don't necessarily feed off your reactions as much. So I think it's really important to me for practicing now, so that when they're a bit older and they ask some more complex questions, I'm ready and I'm not as emotional about it.
Exactly.
Because the first few times I read the book, I had a lump in my throat, but I actually found reading it on my own was more emotional than reading it with her, because when I was reading it with her, I could feel the weight of her head on my chest as I was reading it, and it just felt right. It felt like the right thing to do, and that we were doing exactly what we should be doing, and it was about her. It kind of was no longer about me, it was about her, and that was quite an emotional moment to realise as well. So yeah, I think there's a lot we can do now that will help us in the future.
Yeah. I also think that as they go through different ages, the conversation may change, and the frequency about how often we talk about it, they'll probably lead that. I mean, sometimes I find myself thinking, oh, I haven't talked about it for a while, maybe I should bring it up again. And that's purely because I want to get the practice in. I hear my husband sometimes talking about it when he doesn't know I'm in earshot, and I love it because he says it so naturally. And we talked about the fact that for our children the age they are at 4 and 3, it's, you know, they hear about it, they go, oh, okay mummy, and then okay daddy, and then they move on to the next thing, because it is becoming part of the everyday conversation. And we you know, this is very much a personal choice. We're just talking, we're not therapists, but we're just talking from personal experience, and helping make this a normal conversation, but not so big that it defines them. There's a balance, isn't there?
Definitely. Yeah. I think, we were saying earlier, weren't we, that we will be telling schools just in terms of letting them know, so if they say something, it won't be a massive shock, so I don't want them to have any negative reactions for talking about it. But equally, what I don't want is for that to totally define them, and them to always think, oh, I'm donor conceived. I want them to know that they are. I want them to know that they're much more than that. And there's so much more to them as an individual than how they were conceived.
I think also for people who are thinking about starting this process, and it feels so big at the time in terms of how we ever going to get through this, when they're here and that weight shifts and it changes and you can't imagine your children in any other way, I often forget, because I don't know if you're the same, but I just totally see my husband as their dad, so it's not a big thing. And we talked about before, you know, mannerisms, picking up habits from the parent, that kind of thing, that really show there's a lot of nurture in there versus nature.
And it's everything you do every day for them that makes him a father and me a mother. I'm no less of a mother because I don't share the genetics, and I honestly believe that, and I feel that, and I know that they feel that as well. They are just, I mean, it's really hard to put into words.
I know, and that's why it's so therapeutic to write
I
posts
always
about it.
Yeah, I always feel like I sound really soppy, but it's true. Like they look at me, and you can see they absolutely adore me as their mom, and I'm their first point of call if they need comforting. I am their kind of their comfort, their main comfort, and you just can't replace that. I know, and that is what is forming their memories, so their earliest memories, and it's
Because I
what's
guess Mila's probably starting to have memories now.
Yeah, yeah, oh yeah, she's got amazing memory actually. It's one of the things. How do you remember that?
Yeah.
But yeah, she does, and
But memories for the future maybe as well.
yeah, yeah. I mean, the other week we did Mummy and Mila sleepover where I slept over in her room. She stayed up late, and we watched a film, and then we went to bed. And she was so excited about it. And like, Mummy's sleeping in my bedroom, and
Oh,
just things like that you kind of
amazing.
build, and yeah, they may look and be interested in finding out more about. He leaves me there. They may be interested in finding more about the donor, but it is me that they will remember all those things, and I just don't think that can be replaced. So
And
yeah,
teach them to ride a bike, teaching them all the milestones.
yeah,
Another really important point that you mentioned earlier was that in our previous session was that it's kind of important to also talk to the wider family members about the terminology that's being used, so that there aren't any kind of discrepancy is the wrong word, but you don't want things to be said in an insensitive way that's going to ring alarm bells or send them into a different headspace.
no, absolutely. And I think I mentioned earlier, sorry, my battery's going as well.
Oh, no. We're not having any luck tonight.
No.
Take two.
No, I was saying earlier about how, and it's very, very rare, but where somebody's kind of said something like, "Oh, did she get her curls from the real mum, from the mum?"
Yeah, yeah.
Terminology, and yeah, that was quite hurtful for me. Not intentional. It was just a kind of slip of the tongue. But I think it's really important that within family members and people who are close that you kind of agree what the terminology is. And we said, no, she did get her curls from the donor. But in terms of mother, anything around mum is me. And that's how we talk about it, and that's how the girls will see it. And so I just think you just have to be aligned, and the way in which you kind of inform your family, they will then also kind of speak with your children in that way. And I think that's the best way to do it, because what I don't want anyone to ever say to me is, "Oh, did you get your curls from the real mum?"
Yeah.
Just
And I think
totally confuse her, and
totally.
isn't.
I also think it's important that if other children are told, like cousins and things like that, because we've had this experience, it's really important that they know, or that family members know, that we've got our own narrative to tell. So we need to lead kind of when people talk to them about it, so that they're not hearing things for the first time from other people.
Yeah.
Because I really want personally, I want our children to have known it, not that they'll ever look back and think, oh, that's something mummy told me or daddy told me, but I don't want that shock factor. And I know that's something that we were talking about.
Yeah. Just want it to be something they've never known any different. So it's their normal, and it doesn't seem as alien as it seemed to me when someone first said it to me. It will never feel that way to them, because that is what they've ever known. So
which goes back to the point of it not being a plan B, it being ending up being a fabulous route to parenthood. And we're so lucky for these opportunities these days. And I think we were both saying before that it's wonderful when we have messages that we get regularly from people thinking about sperm donation or egg donation, seeing us 3-4 years on and seeing how positive our experiences have been, and seeing that there is light at the end of the tunnel, there are other options, and being able to relay what we've done, and not because of expertise, but because of our personal experience of it. It's always useful to talk to someone who's walked that path.
Absolutely. Yeah. And I think it just shows you what's possible. And and I think the most important thing is to have hope that you can still be the parent you want to be, of how you conceive your child. And ultimately what we want to do is give our child the best life that we can give them. And that's kind of the driver behind all of the decisions.
We just had a comment, a question. Do you, your husband, feel jealous that their siblings get to have biological children? That's an excellent question. How do you feel about that, Becky?
Hold on, I'm just trying to. Do I feel jealous
Do you
that?
have do you have siblings?
Oh yeah, yeah, yeah. Yeah, so I've got a brother.
Does
Um,
he have children?
no, no, not
Okay.
yet. So it's not come
Okay.
up.
Okay.
To be honest, I think I would be quite intrigued, and it'd be quite nice that I will. If well, he's not with anyone at the minute, so it's not going to happen soon.
See how you feel
But
about it.
yeah, I've not really given much thought, to be honest. But I think it might actually be quite nice to have and kind of maybe see that I see that as being my opportunity to see maybe a slight physical resemblance in
Yeah.
me. But it doesn't mean much more because I kind of feel now there's so much more to it than genetics. So
Um,
um,
I'm
yeah.
actually living that situation at the moment. My sister's giving birth next
Ah,
month. She got pregnant really easily, and I've never once resented it or felt any, that she's so lucky because their child is genetically linked to her and her husband. The only thing I have, and I feel awful admitting this, the only thing that I've sort of perhaps felt is that she may not have understood the longing for a child, having not had to walk the
yeah,
infertility or fertility struggle path. And it's more so that than the donor side.
yeah, yeah. I'd say I still get the sting from pregnancy and
Mm-hmm.
and
Mm-hmm.
I find that really odd now.
I
It's
know, I
what?
know.
I do.
Yeah.
Sometimes it can knock me, and I think it's a past trauma. Um, and I think yeah, it's just part of it that you kind of then were reminded of everything you went through and everything. But um, yeah, so I'm just reading this question. How do you feel about your fertility ovary privacy?
I'm
Don't know
not
if the
sure I
question.
understand that one.
I'm not sure. I'm going to have to go in a second. And
Yeah. Thank
really,
you so much for coming back on. I think we've answered everyone's questions. We've wrapped up what we were talking about before. I'm so sorry for those. We had lots of people watching before who asked brilliant questions, and sadly, we lost it because of a phone issue. So hopefully this will help. And we can always have another session if people
yeah,
found this useful. So thank you so much for your time, Becky.
no problem.
Lovely to chat to you. And thanks everyone for joining.
Thank you.
Okay. Night, everyone. Thank
Take
you.
care. Bye.
Bye.